Well, we found that prostate cancer outcomes are quite different in different countries. Predominantly in the United States, 5-year survival following a diagnosis of prostate cancer is amongst the highest in the world, whereas that in England lags far behind. The multiple differences between the healthcare systems and management strategies in the two countries, predominantly things like PSA screening and the use of radical therapy, both of which are greater in the United States as compared to England. So we looked to see whether or not we could undertake a risk-adjusted comparison between the two countries to see whether the use of radical therapy influences prostate cancer outcomes. In the States, the prostate cancer mortality is certainly lower than that in England, and we've gone on to show that in itself may be one of the reasons why they seem to do, the use of radical therapy in the States may be one of the reasons why they seem to do better than us. Certainly, I think that is a particular issue in prostate cancer where if you've got low-risk disease, perhaps you're likely to die of a cause other than prostate cancer, whereas if you've got high-risk disease, your cause of death is potentially, in a lot of cases, could be prostate cancer. So if you were to offer radical therapy, there are certain side effects that come with it, predominantly incontinence and erectile dysfunction. So it's a difficult decision regarding when to offer and who to offer radical therapy. Well, we've certainly shown that patients with low-risk disease in England who don't receive radical therapy as frequently as they might do in America do as well as the American counterparts at 6 years follow-up. Whereas if you look at patients with high-risk disease, English patients seem to receive radical therapy less frequently, and we go on to suggest that that itself may be one of the reasons why our mortality rates are higher. Well, there's various ways of going about this, and there's currently the PROMPT study being done, which is looking at the use of PSA screening in England, and also a recent RCT reported that radical prostatectomy in itself may not be beneficial in patients with low-risk disease. So there's a fair bit of work being done in this at the moment, and hopefully we'll have some more data to support decision-making over the next couple of years. Mm-hmm. For doctors, it's important for us to realise that patients in England are, at the time of diagnosis of prostate cancer, often tend to be older with higher stage and higher grade disease as compared to the American counterparts. However, when you take these variables into account in a multivariate analysis and then adjust for whether or not patients receive radical therapy, our outcomes are perhaps explained by the lower use of radical therapy in England as compared to the Americans, who much frequently offer radical therapy for patients with more advanced disease.